Hi, everyone. Welcome to a Senior Citizens Forum. I'm Janice Wood, your host, and today a Senior Citizens Forum is being sponsored by Benefits for You Too Insurance Services, where they provide Medicare supplemental plans, Medicare Advantage plans, and prescription drug plans for people that are 65 years of age and older, or for people under the age of 65 with certain qualifying disabilities. But today, we're going to have the second in our series of a bite-sized health with Dr. Henry Kim, where we're going to talk about medication. Your your qualifications are outstanding for a dentist.
Yeah.
Uh, and we went through a lot last month in talking about how important your oral and your teeth are to the rest of your body.
Yes. Well, Janice, once again, thank you for having me back. And yeah, the my specialty is called the prosthodontics, just like prosthetics in medicine. It's prosthodontics, and I'm a prosthodontist who specializes in that specialty field.
I
Um,
hope by the end of this series, I get that pronounced correctly.
I think it's a little tongue twister, maybe. But anyways, that's not to say I do just one thing. I do, from yeah, I do A to Z in dentistry. I do have a hygienist who takes care of the dental cleaning to all the other dental restorations, including the implants, bridges, dentures, and whatever that comes, whatever comes in between. I One thing I do not do is what the periodontist would do. That is a gum surgery. The periodontists are specialists who specializes in doing gum surgeries. So that's something I do not do. But otherwise, I take care of my patient as whole, and I'll try to do my best to keep their oral and dental health uh, optimal. That's what I.
So, do you do some orthodontics too?
Ye-
Adult?
Yes, I don't do adolescent orthodontic treatments. That is for teenagers and younger patients who are just getting their first braces. I do more of a adult orthodontic treatments for those patients who are in need of further prosthetic treatments. So I move teeth into proper positions with the orthodontic treatment, so that I can make restorations uh, looking its best.
Okay, that was interesting. I did not know that. Okay.
Yes.
Yeah. Okay. So I learned something new right there. But one of the things that we're going to talk to today, and
Mhm.
doing some research on this today, I found myself a little overwhelmed because I didn't realize how much we put in our mouth
Mm,
affects us. And we always think about our food and what we drink affecting our teeth and our
right,
oral health, which would be the gums and the rest of the mouth.
right,
Medications.
right, right.
I mean, and there's all forms of medications. I mean, there's, over the counter medications, the medications that you get from your doctor, the supplements that we take,
Yeah.
and even, of course, those street drugs. Okay. Yeah. And
Yeah.
how it affects our bodies, uh, both positively and negatively.
Right. Well, obviously, well, first of all, food that we take, we eat, certainly has an effect on our teeth. If you're eating a lot of sugary food, um, or any food would actually cause your mouth to become acidic, and the acidity in your mouth will actually, in turn, uh, activate the bacteria that causes more acid in your mouth. When you have a lot of acid production by these bacteria, you have what we call dental decay or dental cavities.
Mhm.
A lot of people don't know this, but the dental cavities or dental decay is what we call an infectious disease. It actually is caused by the bacteria that produces a lot of acid, and that acid in turn melts the structure of enamel and thus cause the dental decay. So food is also very important factor in keeping your mouth healthy. Obviously, you cannot stop eating so that you won't have any dental decays or dental cavities. But having a clean mouth right after eating food certainly will help to keep the acidity down, or level of acidity down in your mouth, so that you won't have dental cavities. That's one aspect of what we're taking in our mouth.
We're in such a society now that's so concerned with appearance. So
Right.
think about what we're eating and what we're
Right.
drinking, and how it stains your teeth.
Yeah. Yeah, a lot of the food that we have now are not just artificially flavored, but artificially colored. So there are a lot of food coloring that's going into the food that you take. Um, things like candies, red, orange, blue candies. They will stain your teeth. Certainly, red wines and red sauce. Those things will stain your teeth. Um, we know that coffee and tea will stain your teeth because of just simply because they have dark colors. Uh, but also, tea actually makes the teeth stain more because the tannic acid that's in the tea actually coagulates the blood. So if you have a bleeding gum, if you have unhealthy gum and then the gum bleeds redly, then the tannic acid in the mouth in the tea will cause the blood to coagulate over the teeth, and it will actually stick to the teeth. Now you have a darker teeth because of that. So the tea itself stains the teeth, but it also stains the teeth by having the blood coagulator over the tooth surface. So those are the kind of the food and drinks that that will certainly stain teeth. And when you have a lot of stain, it leaves the surfaces of teeth rough, and they're more prone to have plaque buildup and tartar buildup. So that would you need to watch out for those. Yeah,
Yeah. So that plaque buildup, in case someone doesn't know, that's that stuff that's around the
at
gum
the gum line. Yeah.
gum line, and
Hmm.
that turns to that tartar
Yes.
that
Yeah.
needs
So
to be scraped off when you need to go get your teeth cleaned.
right. So basically, the plaque is just a buildup of whatever that you find in your mouth. It could be collagen, it could be proteins, it could be sugar, or or maybe even minerals from your saliva. Will just kind of mingle or get commingled, or it will just form what we call the plaque. And then, if that plaque is not removed right away, and if the plaque starts to calcify, and it will because of the like, once again, the minerals in your saliva, and once it calcifies over the tooth surface, it adheres to the tooth surface and will not be removed simply by brushing it. it will stay on your tooth surface, and once again leaves a rough surface that's more prone to bacterial accumulation. And once you start having a lot of plaque, plaque turning into calculus or tartar, and
Mhm.
then continues to collect bacteria, you're collecting a lot of bacteria that are causes of gum disease. So once again, your gum disease is also an infectious disease where the bacteria, the bad bacteria in your mouth, that causes the gum disease, uh, to become active, and start affecting not only just the gum but also the bone that's holding the root structures underneath the gum.
Okay. So when we take medicine,
Yes,
well, medicine, I mean, when you're just thinking of taking a pill or a capsule,
right,
it goes into the bloodstream. Will that
right,
cause your teeth to stain or turn color? I know
uh,
teeth do turn color as you age.
right. Yeah, as you age, you simply collect a lot of stains. But one thing that we know that one medication we know that will cause the discoloration or staining of the uh, teeth during their developmental stages, is the tetracycline. You have seen a lot of the older patients with the very brown teeth. It's not because they have collected so much stain, but when they're younger, they were prescribed to take the tetracycline. We didn't. Well, a lot of the doctors didn't know, and parents didn't know about this. But once the children took the tetracycline, it will get incorporated into the tooth buds, and as the tooth buds develops into actual tooth, the tooth will have a lot more brownish in color. Well, it will turn a lot more brownish in color. So that's one type of medication that will stain the tooth for sure. But I don't think they're prescribing those medications so readily to young children because of that. Um, but there are other medications that we should be aware of that causes more of a dry mouth for older patients.
Mhm.
Yeah, because these medications will actually cause your salivary flow to decrease. And when you have a lower salivary flow, the cleansing effect of the saliva is diminished. And when you have lack of cleansing effect of saliva, you have more plaque building up over the teeth, and then that in turn will cause more dental cavities, and further cause more gum disease. So you should be aware what medication would cause dry mouth.
Okay. So the medications, but just aging itself, would that cause the dry mouth?
Well, just like anything else, our bodily function, it will have less functionality or less
Mhm.
effectiveness. So efficiency. So yes, maybe the salivary gland will have a less saliva output, or salivary output. And also, maybe the older patients do not hydrate themselves properly. So if not drinking enough water will certainly cause dry mouth. And 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 because of that, the older patients are more prone to dental cavities. uh,
Okay. So what in the saliva
mm,
itself
mhm.
does I was reading something that was saying that the saliva does the breakdown of the enamel of the tooth. Am I
Uh,
saying that correctly?
no, I don't think so. I don't know
Okay.
if I ever heard that before. But well, obviously, if you are taking a lot of like acidic drinks or citric juice, you certainly are subjecting your teeth to more acidity, and the acidity certainly will cause the breakdown of the enamel, especially on the surface. If you know, well. I used to see a lot of the bulimic patients. So those patients who have uh, also those patients who have gastric acid reflux. Um, they will have acid coming from their stomach back into their oral cavity, and because it's a constant exposure, or they have constant exposure to these acid to the acid for their teeth. They have a lot of what we call the chemical erosions of the enamel. So yes, if you're drinking a lot of citric juices, and if you're having any kind of gastric reflux issues, then you're then you're uh, more prone to have enamel structure damage than those patients who properly hydrate their mouth and drink proper amount of water and have a good salivary flow to wash down any buildup of the acid or any food particles on their teeth and tooth surfaces. Yeah.
Okay. So, how would the medication, because when I was reading earlier, it talked about antidepressant type medications,
Yeah, yeah,
okay, being hard on the enamel of your teeth and affecting the gums.
yeah. Medication themselves, I don't think they're causing any damage to the enamel or tooth structure, but they do cause secondary damage by having the lack of salivary flow, as we talked about before. So antidepressants, or for the elderly patients, a lot of them are taking antihypertensive medications. That is
Right.
medications for high blood pressures. So those medications have a great effect on salivary flow. They normally cause a lot of the uh, uh, what diminished the function of salivary gland, and there's a lack of salivary flow. And when you have a lot of no saliva or lack of saliva in your mouth, that causes, once again, the plaque buildup and tartar buildup. And sometimes it also causes gum to swell up. Um, and when you have a swollen gum, now you have another issue of or for the oral hygiene. You cannot clean your teeth properly because you have a hypertrophic gum, that is overgrown gum that's covering the tooth surface. So whatever the plaque buildup that's under the gum cannot be easily removed. So yes, these medications, the decongestants, antihistamines, antidepressants, some antihypertensive medications. These all these medications can cause dry mouth and play havoc on oral hygiene because of the lack of saliva.
Now, I know high blood pressure medications will do that. So
Yeah,
people need to be aware, because I know I have some dry mouth from taking high blood pressure medication.
yeah.
And it's not something that starts right away. It happens over time.
Yes, yes. Everybody thinks it's they're okay, taking these medications. So they don't think about doing anything extra other than just taking the medication. So for those patients who are taking these medications that are causing dry mouth, should well, one, they should be aware of what's going on, and two, they should do something to hydrate their mouth. Sometimes if it's a very bad case of decreased salivary flow, then there's some saliva substitutes that are out there in the market that they can just kind of put it in their mouth to kind of coat their teeth or coat their mouth. But it may not be the most pleasant uh, thing to take into your mouth. So my best advice for those patients who have dry mouth is that they constantly drink water, meaning they don't have to drink like a cup each time they drink, but they can just take a couple of sips out of their bottle water to hydrate their mouth. They can also try to avoid any caffeinated drinks or alcoholic drinks, because they in turn cause the dry mouth as well. So um, yeah, I wouldn't recommend like chewing gum or taking candies because I think, as we talked about before, any sugary
Mhm.
uh, food or candies or even like cough drops, they can cause dental cavities because of the sugar that's in those candies. Plus, they cause the acidity to rise in their mouth,
I
which in
think I
turn
think
cause dental decay.
that's really interesting because I know dry mouth is not comfortable.
Right.
I think more, I experience it more in at night,
Hmm.
so I
Yeah.
think it's important. Hydration is something that, when you go to the doctor, they're always telling us, "Drink water, drink
Drink
water,
water. Drink water. Yes.
drink water." So if you're having dry mouth symptoms, drinking water is a good thing.
Yeah. And so, as you said, at night, if you're asleep, it's difficult to drink constantly because you don't want to be waking up in the middle of the night, so many times to, take a sip of water. So I think maybe drink, maybe not too much, but just whatever you think it's adequate to keep your mouth hydrated. You can take, maybe half a cup. Certainly, you don't want to, take too much, drink too much to have frequent visits to restroom in the middle of the night. So, but certainly drinking a certain amount of water to hydrate yourself, hydrate your mouth before you go to bed, I think that's helpful. There are a lot of patients who are mouth breathers when they're asleep. So, if they're breathing through their mouth, they can maybe try to have like a humidifier next to their bed so that
Oh,
the
yeah.
air is not completely, air, so that you'll have some moisture in the air. So when you're actually breathing in through your mouth or even through your nose, that you have some moisture in the air next to you. So having a humidifier may help, but obviously the sometimes that the feel of the like a mist over your face while you're sleeping may not be pleasant either. But if you can handle that, then I think that can be helpful as well.
I think that would help your eyes too.
Yes, and your skin also maybe
Yeah, yeah.
yeah.
It
Uh,
would have other benefits to it. Yeah,
yes.
right. But when we're saying drinking, I want to make sure I know. I do a lot of working out, and I had one time the trainer said to the person, "I don't mean coffee, and I don't mean a cola. I mean water."
Right, right. That's that's very important because a lot of people, would drink, tons of, drink or water substances or
Yeah.
substitutes, right? The sodas, even seltzers,
Hmm.
uh, uh, even juices, coffee, tea. Those are all, yes, they all have water in them. But if you're drinking coffee instead of just this, just pure water, then you're taking also a lot of caffeine in your system, and caffeine will also cause you to expel water out of your body more often than you would retain water. So and that's something you have to think about when you're thinking about how much water you're taking in each day.
Yeah, and water is just so important for us anyway. I mean, it's just,
Yes.
yeah, what
Yeah.
could say? All right. One of the things I know someone who just went through chemotherapy.
Yes.
Okay, and nobody told him he needed to take care of his teeth during that time, and now he's having a horrible time with his teeth, and they're saying it goes back to the chemotherapy.
Uh, chemotherapy. Yes, maybe the medication that you take. I'm not so sure about the medication uh, that will cause dry mouth, but certainly these medications are designed to kill off even your normal cells. So yes, it's gonna cause you know uh, some of the breakdown of your of your own tissues and your bodily organs, um, in effort to kill off any cancer cell. So one, I know that a lot of these patients who are going through chemotherapy are tired, and they're not able to really take good care of their oral hygiene. So that's one thing that we would emphasize. Even 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 when you are healthy, and if you're not taking good care of your teeth, it's difficult to maintain the health of your teeth. But when you're tired, going through chemotherapy, and you're not able to maintain your good oral hygiene during the treatment, it's going to be more difficult for patients to maintain their dental oral health. So I think that's something that I'll mention about the chemotherapy. But more important than chemotherapy is the radiation therapy for
Okay.
those for cancer patients. A lot of the patients who are going through the treatments for oral cancer, they're gonna have what they probably have options of going through just the chemotherapy or radiation therapy. And if you're going through radiation therapy, they got to make sure that they protect their teeth from all the radiation they're taking. So if you go to the oncologist, they often work with the oral oncologist, who would or dentist who will provide a protective tray that you would wear over your teeth. That is to prevent the over radiating the teeth. What happens with the radiation is that your teeth end up with what we call the radiation dental decay, and it basically kills off all the organic component of the teeth. That is the internal portion of the teeth. So enamel is somewhat inorganic, so it's not affected as much. But if you put a lot of radiation through teeth, all the organic portion of the teeth, which is the pulp and the dentin underneath the enamel, it starts to decay because of the radiation. Now, when that happens, there's no real good dental treatments to restore those teeth as they start to break down, because it's just going to crumble from inside out. So if you have a normal dental decay, you will have a decay starting from outer surface moving in, so we can just take out the outer surface and do a filling. But if you have radiation decay, everything just decays out from the inside. So we basically end up losing teeth. And if you go through radiation therapy, it also affects the bone around those roots, or teeth. So now it becomes a very tricky situation. Teeth break down, and the bone's not so healthy. So if you have to take these teeth out, now you have a big problem. The teeth are crumbling from inside out, and then also if you have to extract those teeth, it's difficult to grab those teeth because they all break down. And even if you extract those roots from the bone, sometimes the bone healing is delayed, or it may not be, the bone may not properly heal.
Okay, so that would make it really hard to have implants put in.
Yeah. So those patients, we do not recommend uh, dental implants. So, so just going back to the beginning. So for those patients who have oral cancer, and having even having radiation therapy, even though those radiation therapy may be very focalized, for necks or tongue or base of the tongue and things like that, they got to make sure that they have properly fitted protective trays or protective liners over their teeth to minimize the radiation to their teeth. Um, and and for those patients who unfortunately have those dental radiation dental decay, they just have to just maybe go through uh, proper maintenance first. And if their teeth are not doing so well, then we start we try to keep them comfortable by either taking teeth out, or just let them break down and just have a denture made over the teeth. I have one patient who's right now going through through that exact treatment, because he had the radiation therapy and all his teeth are just breaking down, and it's unfortunate, but we tried to make the best of what of his situation by providing dentures whenever we can.
Okay. So when you put that protective tray,
Hmm.
I mean, through the radiation, I'm thinking, okay, it's going to protect the tooth itself, but
Yeah.
but how is it going to? I'm using my hands here.
Yeah.
Going to protect my jaw. I mean, this part is
Mm,
still going to be affected by the
yeah.
radiation.
Right. So it all depends on where the radiation therapy is taking place. Like I said, if it's at the base of the tongue, sometimes they have to have the radiation coming from the bottom up, and if that's the case, sometimes it's even having the protective tray over the teeth. Let's say it's lead lined tray. It's not going to be very helpful sometimes. But nonetheless, like as I said before, we try to give as much protection for patients' teeth as possible, so that the damage will be minimal, or it won't be as much without the protective tray.
So if you have cancer, I would say from the throat
Up, yeah,
up,
yeah,
okay, that your mouth is really going to be affected along with the
yes,
bone structure.
yeah. So any hard tissue, we call bone and teeth hard tissue, and any hard tissue should be protected as much as possible from the radiation. Um, unlike the dental X-rays, we're talking about a lot of radiation for patients who are going through chemotherapy, cancer therapy. So just if you know any elderly patients who are going through any oral cancer situation and having radiation therapy, they should be fully aware of what that entails. And so oftentimes, they may be going through just the chemotherapy, if the medication would be enough to control the cancer. Uh, but uh, yeah, so make sure. So having a good oral hygiene and a healthy mouth prior to any cancer treatment will be very important, because no matter what kind of cancer treatment you go through, it's going to be very tiring for the patients, and it's going to be difficult for them to even think about just taking even brushing their teeth. It's going to be difficult for them to even to eat. So yeah, yeah, I mean, we talk about hydration, good hygiene, dental oral hygiene,
Yeah.
but we got to make sure that we have a good education, uh, for those patients who are, especially for those patients who are going through cancer treatments.
Yeah, the cancer treatment, because I know a lot of people. Me personally, I've never been through cancer treatment, but I know people that they come home,
Yeah,
bring everything up, and if you don't clean your mouth afterwards, that acidity is not going to help.
yeah,
And it's this is interesting because I don't know anybody who's ever said their doctors have said, "Gee, you need to go to the dentist before we start this."
yeah. Because if once, like I said, once the chemotherapy starts or the radiation therapy starts, it's going to be difficult for any cancer patients to have dental work done. So make sure that they're in a pristine dental oral condition prior to starting any of those cancer therapies, so that they don't have to deal with dental treatments or oral treatments. If they can avoid it completely, because they have a good hygiene and good maintenance during the therapy, cancer therapy, I think that will be an important aspect of overall treatment for those patients.
So I'm just sitting here. I have a little niece, and I know this is not a senior citizen question, but I have a little niece who at age 4 was diagnosed with leukemia. And
Yeah.
now she's sick, and we're so excited because she gets to ring the bell. But
No.
does that affect her teeth also? And
That I'm not sure. Leukemia
yeah,
is well. Obviously, I'm not the
yeah,
dental oncologist, so but
right.
I'm sure I bless her heart. Just for her to go through you know therapy, and any kind of treatment. It probably was so hard for her to just to go through whatever the treatment she had to go through. Um, but I'm glad that she's now okay, and maybe that
Oh yeah,
now that she's okay, she really needs to take good care of her teeth. Yeah.
yeah. Because I know in May she gets to ring the bell.
Oh, that's good.
Yeah,
Yeah. So she needs to eat well now. So that
right.
means she's gonna need her teeth for proper digestion. So so and also to to have a restoration, or physical and restoration, she is gonna have a good
Yeah,
nutrition, right? So yeah, so take having good teeth will certainly help, and I think
right.
yeah, that will be the goal for her moving
Yeah.
forward. At least generally speaking, yes.
Something extra to look at in case a grandparent has a
Mm.
know someone like me. I know that's my it's my great niece. Okay,
Yeah, yeah.
something that people go through in age. You just don't know. Okay,
Yeah, we take a lot of things for granted, but just just having a good health is just something we don't really think about so much as a gift, from
it
God.
is having good health is a major gift.
Yes.
And I think even when I get something, a cold or a virus or that horrible COVID, okay,
Mm,
and you come out of it, I'm going, oh my God, I have to thank God that I have such that I'm lucky. I have a
yeah.
healthy life. Yeah,
Yes. Yeah. So I always say to senior patients or elderly patients,
yeah,
if you're gonna have any dental treatments or maybe even other surgeries, whatnot, have those done if they're absolutely necessary. From your MD and surgeons
right.
who are doing these surgeries, have them done when they're still young and or younger, and have better health, because the recovery from major surgeries is not an easy thing. So it takes a lot of time, it takes a lot of effort,
Yeah,
and certainly having a healthy body will be helpful. So if patients are not so healthy, it's difficult for them to not just go through the surgical procedures, but also have a proper a recovery from them.
one of the things that I found, and this is from my personal, is that way over a year and a half ago,
Hmm.
I had knee replacement, and
Right.
the dentist goes, "You have to take an antibiotic." And
Mm.
I wish that to have my teeth clean. And I know you and I talked about it privately at
Right.
one point, okay? And I wish the doctors would have said beforehand, go in and have your teeth cleaned.
Yeah. Right.
I know now it's been like almost 2 years since I've been to the dentist because I'm used to going every 6 months. I can't
Hmm.
wait to go to the dentist and not have to take antibiotics.
Yeah. There was I there, it's a now the recommendation and the protocol put out by the orthopedic surgeons for those patients who have artificial joints. In those artificial joints, there's a lack of blood flow, right? No actual blood vessels getting to those artificial joints. So if you end up with the bacteria in your blood system, especially through let's say poor or mouth with the poor oral hygiene, that with the readily bleeding gum, you're introducing a lot of bacteria into your blood system, and as it circulates throughout your body, and if it ended up in your artificial joint and it didn't get flushed out, or it didn't get cleaned out right away, then you may have a buildup of these bacterial or you might have these bacteria buildup that may cause infection over time. And it's going to be a difficult procedure to clean those bacteria out from the artificial joint, because you can't really reopen the joint. If they go in there endoscopically to flush out the bacteria, it may not be as effective. You can't really count every single bacterial cell to clean them out to avoid any kind of infection or proliferation of bacterial cells over time. So that was the reason for the orthopedics orthopedic surgeons making the recommendation that you have antibiotics prior to having dental cleaning, so that you have antibiotics to kill off any bacteria that might be introduced into your blood system.
So after you have that artificial joint
Yeah,
he's put in your body, after 2 years, it's okay to have let's say, have teeth cleaning or dental work done
yeah.
without an
Antibiotic.
antibiotic.
You could say that. Like I said, it's a recommendation. It's a protocol introduced by the orthopedic surgeons. Um, but if you have healthy mouth and there's gonna be very little to no bleeding from your gum while you're having dental cleaning, then their chances are that there will be no or little bacteria getting introduced to your bloodstream, and your body, if you're healthy enough, then any little bacteria that's introduced to your blood system will be cleaned out by your immune system. um, so I don't think you'll have a lot to worry about, and also by then your artificial joint should be somewhat capsulated, isolated, and you should have enough of or there should be enough of a protective layers around the joint that you don't have to worry about bacteria getting into an artificial joint.
That's interesting. Okay,
Hmm.
so I'm going to go into a different area right now.
Hmm.
Okay, and I know it's one that it's not medication. Let's just talk about supplements. Okay,
Supplements, sure.
supplements, because we take supplements. Supplements, I know my doctor always wants to know the supplements that I'm taking,
Mm-hmm.
because supplements, people think, well, they're good for you because they're more natural. But the more you read about supplements, the more you find out they may not be so good for you. Okay. Or what you think they're doing may not be working. But how
Well,
can those supplements how can they affect your gums and your teeth and your bone structure in the
yeah,
mouth?
yeah. Certainly, you want those supplements so that you can have a proper nutrients introduced into your whole body. Um, Maybe one that I may be more interested would be like something like vitamin D, right? For calcium intake, you need vitamin D. So if you're not getting enough sunlight or something, that you're not in, you don't have enough vitamin D, or if you're not drinking enough milk or
Mhm.
something, uh, then you may not have a proper amount of calcium getting into
Mhm.
your system. Now, calcium certainly is an important fact or important component for your bone health and teeth health of your teeth. So I think that would certainly is something you need to make sure that you're getting proper amount to make sure that you're getting enough calcium. Um, oh, I would tell you a little bit about those patients, though, especially the elderly patients who may be diagnosed with the osteoporosis,
Mhm.
because those patients are certainly having those supplements like calcium and whatnot, but those patients who are also taking uh, bone medication certainly have to be aware of what the medication can do for their bone. Um, Especially a medication called bisphosphonates. These are the medications that could be taken either by mouth or by shot. But these medications actually cause what we call the osteonecrosis of the jaw. Um, when the teeth are taken out, or even when the bone is when there's any dental treatment, or especially like implant
Mhm.
therapy, if the when the bone is involved, you have to be very cautious of what your bone, or how the bone will react to those therapies if you are those patients who are taking these medications. We know that that not every patient who takes the medication will be affected, but there's a good number of patients who are out there who would end up with osteonecrosis of the bone of the jawbone because of the bone medication.
So is because of the bone medication. That's
Yeah,
interesting. Okay.
yeah,
Now I know a lot of ladies out there take, and I'm one of them. They get the shot,
yeah,
and does that help the bone, its
yeah,
line?
yeah. So those medications, I think they're. I'm not I'm not the specialist in osteoporosis, but they're to reduce the bone loss or the so that but uh, what it I guess we shouldn't have talked about the exact mechanism, but it prevents the bone from healing properly, and that's the problem.
Hmm.
So when the bone is not healed properly, it kind of leaves like inflamed area. So the bone may not be fully back to natural state, and there's always inflammation or necrosis of the bone surfaces, and in turn it causes the gum to be inflamed all the time. So you will see kind of reddish swollen gum over the affected bone. Uh, so those patients who are going through therapies, medication therapies for osteonecrosis should be aware of those of such event, so that they, if they were to take have any dental treatment done, such as extraction or maybe even implant,
Hmm.
they should consult with their the MDs and their dentists, so that they may have to discontinue the medication for a certain time to have the extraction or implant placed, and then go back onto the medication after the treatment's finished. Um, Normally, oral medication is not so is not not that big of a concern, but I think it's more of a IM. If you're taking if you're taking a shot for those medication,
Right.
then it's more you're more prone to having such event. But
Okay.
you should certainly consult with your doctor and also your dentist. Make sure that uh, you're one good candidate for any of those treatments too. And if you do have to have those treatments done, make sure that the medication is controlled or even discontinued, so that there's going to be proper healing of the bone.
Proper hair. Okay. That's interesting because I never even thought about that. So if I had to have an extraction or I had to have something done in my mouth and I get the shot, that I need to talk about that before all that happens.
Yeah, yeah,
I mean, that's I never thought about that as that's something that you never know when something is going to happen. So that's I find that this to be too interesting, very interesting. I want to touch on really. It's one other thing I wanted to touch on before I go into the illegal, before we wrap this up today.
mm.
I want to talk about those not illegal. I want to talk about those street drugs that are not prescribed, or there's sugary over the counter syrups, okay?
Oh, I'm not sure.
Cough medicine.
Oh,
In order to get it to taste good, it's really they have to put some kind of sugar or artificial sweetener in there to get it to taste good.
yeah.
So how does that affect the teeth? Is that going to affect the teeth? I mean, I would say go brush your teeth right away after you take it.
Yeah, I'm not sure about the street medicines or street drugs.
Yeah,
I'm not quite sure. I've seen a lot of the patients who are on drugs
yeah,
tend to have a lack of hygiene, so so that might be affecting the. And if you're not talking about just one of those major drugs, or if you're just looking talking about, I don't know, any other over the counter or street medication that had to be sweetened. I will go back to what we were talking about before, taking like about taking candies or any
yeah.
sugary food. it's gonna, if you left them in your mouth, and they continue to, provide sugar to the bacteria that's causing the acid production, and in turn dental cavities, then we have a big problem, because those medication will feed the bacteria that's going to cause the dental decay. So we certainly don't want them to linger in your mouth. If you do have to take them for whatever reason, and then I would say, I I agree with the Janice. Yeah, go brush your teeth right away, or go drink some water right away, so that the you can take down any sugar from your mouth, and make sure that the your mouth stays more neutral than acidic.
Well, definitely rinse your mouth out if you're not in a place to
Yes.
yeah,
Yeah, so that goes back to what we are talking about before, like hydration, like,
right.
drinking water, just simple water, on a regular basis, so that you're always, one, hydrating your mouth, cleansing your teeth, two, to reduce this acid, produced in your mouth, so that your mouth doesn't become so acidic, and two, three, if you are drinking water, you're also taking down the acid that might be coming up from your stomach. So that also helps. So that's something that maybe is a takeaway point, from this today's talk, because you want to protect your teeth from acid attack on your teeth.
Yeah, so it's important. We're going to go back to the basics again. It's so important to brush your teeth a couple
Mm-hmm.
times a day, and
Mm-hmm.
even to get in there in those I want to say interproximal spaces, but in between the teeth,
Yeah.
and getting the stuff out, because
Right.
even the syrupy type drugs or even drinks can get in between your teeth
Yeah.
and stay there.
Yeah.
And the hydration of plain old water.
Yeah. Yeah, and brushing your teeth is certainly helpful, because one,
Yeah,
you're reducing the number of bacteria, or you're lowering the bacterial count, and when you do that, you have less of those bad bacteria that's causing the dental decay or gum disease. So yeah, it's not just to simply to remove plaque and any food from your mouth, but you are also removing the bacteria from your mouth as well. So now you have a healthier mouth, because one, you have less bad bacteria, two, less food or plaque buildup. So that's a win-win situation. If you keep your teeth clean, your gum will stay healthy,
yeah,
and when you have a healthy teeth and healthy gum, you'll be able to eat well, and then keep your overall health optimal.
yeah. So I want to say thank you so much for coming on again and giving us that bite size. I want to say oral health. I'm going to change that to oral health information for us.
Thank you.
And Dr. Kim will be back with us next month on the second Thursday of every month, giving us some more great information that to think about how to keep your teeth in your mouth clean and healthy,
Hmm.
so the rest of your body will help. It will help keep the rest of your body healthful. Help.
Yeah.
So please come join us again for some more bite-sized health information from Dr. Kim. Thank you, Dr. Kim, for coming on today. This is great. It's been a lot of fun as always. And everybody else, have a great week. And please join us again on the Senior Citizens Forum next Thursday. We always have at 2 o'clock Pacific time a new show with some great ideas. Thank you, Dr. Kim.
Thank you, Janice.
Thank you.